the United States, uh, devastation across the United States and devastations across the globe related to so many issues. And we became aware very quickly that people's vulnerabilities related to COVID-19 were very specific and related to their identities, not only demographic identities, but identities in general. And we began to see all the disparities that had been that we had been becoming knowledgeable about. And so, interesting enough, this meeting, which we started with, a simple question about stigma, has become much more complex than that. Uh, and we have been focusing over and over again on issues related to identity and vulnerability. And we have been focusing on areas of the United States where the pandemic has really um, developed faster and very powerfully. So we had discussions very specific about New York with guests from New York. We had conversations about Detroit with many guests from Detroit. And today I asked a few guests from New Orleans and from Louisiana. They are not all in New Orleans to come and talk to us about what's going on in there and to help us understand identities that are being affected by the pandemic in Louisiana and beyond. I also have an LGBTQ plus focus for today because it is a population that we have not, well, I should say populations because it has even the plus at the end, right? We have not particularly, talked about those populations in this forum. So I wanted to make sure that we do, and so that's why it's there. And so I'm going to be asking questions to people about those things as well. Before we start the conversation, which we will in a moment, I would like for you to take a look at the chat box, which can be accessed by clicking the chat, like the balloon, down below on the screen. And there you will see the names of all the people that I have invited for today's session. I put it in there so that I can avoid having to introduce each and every one of them. They will do that as I call on them. So I am asking my guests when I call on you to say your name and your affiliation and where you are, right now. That would be very happy. And before we start, thank you so much for doing it. I also would like to say that I don't do this by myself, right? I mean, I have a lot of help from Nikki Williams, who is behind everything that we are doing here today, and I have been terrible about thanking him publicly about the work that he has been doing. I mean, without him, we would not be here doing this, right? I mean, he has to schedule, make sure that everything is going well. And I say that also to let you know that if you have any audio problem, anything that is related to the technology, you can connect with Nikki through the chat box, and he will help you resolve whatever problem you may have there. Um, I also wish to acknowledge the Faculty Alliance for Diversity, my colleagues who are members of the Faculty Alliance for Diversity, and with me being the co-chair of such committee, that's how we started to do this. Eddie Weaver, who I think just joined us, is my co-chair, and I'd like to also acknowledge Todd Horencall, Lorraine Gutierrez, Trina Shanks, and David Cordova, and I'd like to acknowledge also Larry Gint as a director of our Diversity, Equity, and Inclusion um, program. So the last thing that I will say, since we are focusing on Louisiana, right below the names of my guests, I gave you some statistics that it just came out today, but they are, well, the statistics came out on Tuesday, but the publication is speaking about them came out today. So if you go to NOLA.com, it is reporting that Black residents of Louisiana are dying of coronavirus at vastly higher rates than people of other races. And new data shows, the data that came on Tuesday, those dramatic disparities are occurring across the state, regardless of demographics of different communities. The new state data shows there is virtually no part of the state where Black communities are not suffering the most. Black Louisiana residents account for 57% of the 1,400 people who have died of the virus, while they only make 33% of the state's residents of the population. More than 52 out of every 100,000 Black people had died of the virus as of Tuesday. The same rate for other races was 2.65 times lower. That's what's being so it's just one more piece of confirmation of the nightmare that we knew this pandemic would become. And pandemics have a way of showing their ugly head every time that they come about. If we look in the past to find connections to other pandemics. So I have invited Robin McDowell to talk to us a little bit about different pandemics. She wrote a beautiful piece, which I will post on the chat. Not only the piece was beautiful, but the whole format of the report, which was not just her piece. There's like many things in there. A wonderful, really fabulous the format. So I will paste it in there so that everybody can see it. So I'm going to start by asking Robin to give us like a very quick, what should we know about the history of pandemics in general and in particularly in Louisiana, and if you can begin to connect, those pandemics also to the HIV epidemic, which has ravaged the LGBT plus community for several decades. So we will start with a little, and I can go back to I will be going back to you, Robin. So you say a few things, and then we move to the next person. But we'll start there, and then so all my guests be prepared to be called depending on how the conversation goes. So without further ado, the only thing that I'd like to do before we actually move to the next phase of this discussion is to ask you to concentrate for a few moments, and I'm going to ask us to have a moment of silence dedicated to those that we have lost to the epidemic, and to think about those that we're still about to lose. I thank you very much for allowing us to have this moment of silence. And so I'm going to go to Robin, and please make sure to say who you are and your affiliation.
All right, I'm unmuted. All right, thank you so much, Rogerio, and thank you a lot, Joan Scott, too, for the invitation to join. And so I'm a PhD candidate in African and African American Studies at Harvard. I'm also an organizer in New Orleans with the groups Take 'em Down NOLA and the New Orleans People's Assembly. And I moonlight as a French Quarter walking tour guide. And so I am coming to you straight from the 8th Ward of New Orleans right now, which we should acknowledge is stolen land, originally goes by the indigenous name of Wancha. And so in terms of giving some historical context, I wanted to talk about certain ideas and social structures that have reproduced racial difference and hierarchy in New Orleans really for centuries. And one thing I'm noticing amongst local historians is that they make comparisons particularly to yellow fever plagues of the 19th century in New Orleans, during which the city ordered quarantines for a total of 23 years, to give an idea of how often and how severe plagues ravaged New Orleans, particularly coming from the port, coming from sailors, coming from slave ships all over the world. And so what local historians are doing right now is they're kind of doing this historical narrative as comfort thing, and using an adage that's like, we've gotten through this in the past, we'll get through it again. I disagree with that. And I want to go deeper, and I ask the questions, who and who is not included in that resilient we, and why? And so actually, if it's okay, I brought a little image to show you that that I thought actually encapsulated all these ideas really well, instead of talking too much. And I'll hold it up. It's this picture right here. I can send it out to the group on a link as well. But basically, what it shows is, it shows two Black men carrying a dead body. And what's happening with the plagues is that there are new and expanded racialized work that comes from this idea of statistically manufactured Black immunity. So journalists in the 19th century write about Black people, about newly arrived immigrants living in abject conditions. Doctors and nurses won't even go to treat them. They leave them to die in their homes. And so then they're left uncounted in medical and government reports that then say, oh, Black people, Irish immigrants are immune because we've had, no reports from the doctors and hospitals who aren't going there. And so then, because Black people could be both immune and statistically disposable, the work of handling contagious bodies becomes racialized. And then, as I mentioned before, we have indigenous communities who are completely absent from anecdotal and medical reports, who suffered from European disease long before the official founding of New Orleans. And in terms of these 19th century narratives, they're considered always and already disposed of. And then to kind of create that racial difference, we have the idea of white people, particularly white women, being protected by legally issued 19th century social distancing. And we can see this in city ordinances that require families to observe funerals from a distance, or even observe them from outside churches. The wealthy white families primarily are not allowed to go near bodies. They're not allowed to handle dead bodies. So these legal protections, they calcify and they naturalize white fragility, particularly white female fragility. We also see this in documentation of migrations of widows outside of New Orleans into the Cajun coast, into the river parishes. And then again, in this picture of kind of a funeral, I'll send the link, we see nuns and priests who can be close to the dead bodies. There's this idea of sort of divine immunity. But what I'm interested in is the message this is sending about whose deaths were worthy of recognition by the governing body of the Catholic Church, and who could be afforded dignity even into death. So I'm going to send that link. And yeah, that's all I have for now.
So Robin, if you could send the links to us, it would be great if you could put them in the chat. I do have a question for you before we even, I'm going to ask you the question, and I'm going to be asking Lady Carlson to think about the same question. Then I'm going to be moving to her to ask her and Khalid if they can comment on what Robin just said and how current those things might be. So Robin, if you just give us do you think that those things are current? I mean, do we see repetitions of those things? And as we move to Lady Carlson, I would like to know, what she's thinking, what Khalid is thinking about the disposable body, and the idea that we know that in the United States, the majority of people, frontline people, cleaning. We even had testimony a week or two ago, about people who actually are cleaning the places where infected bodies are, and over again, what we see is that is people of color doing that very that kind of work even today.
Mm-hmm. Yeah, absolutely. And I think that this could be really most starkly seen in what is going on with our hospitality workers in New Orleans, who basically run the city. And this is, again, disproportionately affecting people of color, and primarily the working class New Orleanians who, again, are exposed, the most exposed, are serving it's increasing a wealth disparity. And this also feeds into issues that I've been noticing, and this is one thing I've been hearing about in particular, of kind of the same communities suffering during Katrina that we're suffering here, particularly folks in the lower Ninth Ward, not only cut off from easy food supplies, cut off from the transportation isn't running to get to work if they have hospitality industry jobs, and also access to medical care. It may take someone 2 hours to get from certain underserved areas of the city to a hospital to begin with. So there are structural things here still that are kind of reinforcing disposability and who has to go to work that involves exposure.
Thank you so much. Lady Carson, would you like to comment on that?
Yes, shall I just tell you a little bit about me before I comment?
Yes, absolutely.
Okay.
Always.
My first name is actually Lady, so let's clear that up. We don't have to spend time pondering that. I am the lead organizer in what's called the West Side Sponsoring Committee, which is our local Industrial Areas Foundation affiliate. But then I'm also with Together Louisiana, which is the statewide organization as well. I've been organizing since 1991, mostly in Texas, but then moved to Louisiana about 16 years ago, and have been mostly in the north part of the state, but now I'm in the southern part of the state. And I'd like to answer it in a couple of ways. One is this: yes, I'm seeing the disparities. And where I work is actually, Louisiana is 2 states. There's the northern part of the state, and then there's a southern part of the state, which is along the I-10 corridor. The bulk of the population is along the I-10 corridor. But I work in the part of Baton Rouge, the Baton Rouge area, that's on the west side of the Mississippi River, the west side of Interstate 10. And when you cross the west side of the river, you've basically moved into another country. I mean, we talk about, people see New Orleans kind of as Louisiana. Well, the other face of Louisiana would be Baton Rouge. Nobody talks about the rural areas. Agriculture is still, they still have agriculture there. But the other thing you see in terms of the racial disparities is the preponderance of plants that are in or around Black neighborhoods and poor Black communities. And the state companies have the right to take your property to build a plant through eminent domain because it's in the public good. And so you have these people that are poor and Black that are sitting on top of these plants. The EPA, there is no EPA here. There is no Department of Air Quality here, really. And so in places like St. John the Baptist Parish, they have one of the per capita highest proportions of deaths in the country. There's a nursing home that's been devastated. Now, the one thing about St. John, and when I'm talking too much, tell me if I go on too long.
No, you're doing just fine. And I look at the faces here. We are appreciating the structural descriptions that you're giving us, which is so important.
And so the thing about St. John the Baptist and the deaths there, that whites have been dying in St. John, but there's a veterans home, a nursing home, where a large number of the deaths have occurred. And then,
it was on television, in the past couple of days.
Yes. And then we have some leaders. This African-American leader told me one day, I'm afraid to answer the phone. She said, because every time I answer the phone, somebody I know or somebody that has my family, somebody has died from the disease and virus. And so it's been very devastating. Harvard, there's a research paper I'd like to get a hold of, done by some Harvard researchers. That surmises that the reason that the deaths are so high in places like St. John and St. James is because the particles, the pollution particles, are smaller and easier to get into your lungs and into your body. And then I'd like to, so that's St. John the parish. I work in 4 parishes. I'd just like to describe another parish, Point Capee, which is more New Orleans than it is Baton Rouge, even though it's right outside of Baton Rouge. More New Orleans, more French than again, more New Orleans. Point Capee it's one of the poorest parishes in the state, and it has a growing Spanish-speaking population because now African Americans do not work in the fields. They don't want, that's not a job that African Americans have done. And so there's this influx of Spanish-speaking families into Point Capee, but they're very isolated. A lot of them are monolingual Spanish-speaking. Before the virus hit, clinics have refused to see them because, they said, we don't understand Spanish, and so we can't treat you. And so they've literally turned people away. And then there's fear in the community because there's not a lot really of information in Spanish. And we're trying to address that, but that's the other dynamic that's happening on the west side of the river.
Oh, this is really incredible and great information. I would like just a very quick question. I think I'm going to ask Jen, if you don't mind, Khalid. I'm going to go to Jen for a moment, and then I'll come back to you because I'm curious about this New Orleans Baton Rouge division. And Jen is in Baton Rouge. So could you give us a perspective, that the Lady Carson gave us from your, your perspective?
I think Khalid and Lady
and tell us who you are, of course.
I think Khalid and Lady may actually also be here in Baton Rouge with me. I think that kind of what we're hearing from Robin and then and what Lady is sharing really points to what I think is really important about understanding the effects of COVID here in Louisiana is that these disparities were here before. So what the virus and what this pandemic is doing is shedding a very bright light on health inequities and structural inequities that were going on for centuries before this. And if you look at the mortality rates, the white-black gap in mortality rates by diseases that are the major risk factors for mortality from COVID, we see a great disparity and a higher rate among both whites and Black people from before the pandemic. And so I think it's unfortunately unsurprising that we're seeing these disparities here today, and I think they show up in everything, including in the in the deaths of essential workers and who's still working, and then also I think other things that we're newly contending with is really kind of the larger impacts on this, on the immigrant working population and people that are have a lower access to information about the disease because information, multilingual information, hasn't been fully accessible from the state, and so I think we're really kind of coming to understand the impacts of this among other communities. I think that's all I really have to say right now. I kind of want to go on to, I think it's also important to highlight that there have been real efforts by organizers and a lot of people in the area to work to deal with and address these structural inequities from before this pandemic, and that there's I think renewed bigger and hopefully a moment of opportunity, including the formation of a health equity task force by our governor to try and look more closely at what's going on.
So Jane, could you just tell us quickly who you are and maybe like and then I'll move to Khalid.
Sorry, I forgot to do it. I'm Joan Scott. I'm an assistant professor in the School of Social Work, and I'm one of Rogeria's former students from, we're not saying how many years ago.
We don't tell that.
Yeah, so we met in New York many years ago and have stayed in touch, and so I'm very excited to be able to be a part of this conversation as well.
And thank you for coming.
And then I've been working with Khalid and Lady and Robin here in Louisiana.
I love when Jen says lady. I still cannot say just lady. I still have to say Lady Carson.
That's okay.
I'll get there, I promise.
No, that's okay.
Khalid, please introduce yourself and tell us a little bit about the work we've been doing in there.
Yes, my name is Khalid Hudson. I'm originally from Chicago, Illinois, and don't hold this against me, but I'm a graduate of the University of Iowa, so I am a Hawkeye, for those that are Big Ten fans and whatnot. But so I've been organizing in Baton Rouge with Together Baton Rouge for about a little over a year. I started off organizing in Jackson, Mississippi, which is just about 2.5 hours away from Baton Rouge, and I was asked to move here to Louisiana to participate in a huge fight. Together Baton Rouge Together Louisiana was in the midst of a fight with the largest industry in the world, the oil industry, around the disparities that these entities do not pay taxes, right? And so and the reason why we're in this fight is because our communities are under-resourced, right? This is something that is well known about many states, but in Louisiana in particular, you can have a zip code that is the wealthiest zip code because of the oil industry, but then be the poorest zip code where you're dealing with communities that do not have grocery stores. You're dealing with a failing transportation system. Those same communities do not have access to primary care and a host of other things that fall in line with the social determinants of health. So then when you're faced with a pandemic, all of these aspects of the social determinants of health come into play, right? And early on, when we first went into this shelter in place, a group of leaders and myself, we went to meet with the mayor of Baton Rouge to discuss kind of what was going on, or how was she thinking about the coming pandemic that we all were starting to anticipate. And one thing she brought up was that she was concerned that when tests were administered for COVID-19, that they were not noting the race of who the test is being given to. One of the reports that is started to emerge is the disparity around who has access to be tested, right? And so that helps to perpetuate, as it was stated earlier, perpetuate this myth that somehow melanin was the protection against COVID. But we just didn't know, right? We just didn't know how fast this disease was spreading through our communities. It was probably here well before any of us have ever thought about. I mean, beyond even Mardi Gras. But that was a concern of the mayor, and a concern that the organization shares, is that, how do we know that there's some equity and equality in an administration of tests that every community, particularly in the beginning, had limited access to? And so, but then we all wake up and start hearing these numbers. Around 70% of the deaths around COVID are that of African American people. And it draws to mind actually a story or engagement that I had just a couple days ago. There's a leader here named Lionel Barzil, who I hadn't called in a while because I know that he was taking on a greater responsibility with his aging mother. But he was on a meeting, on a call 2 days ago, and what he shared was that 6 of his family members are dealing with COVID, 6 of his aging family members. That he has a nephew that had flu symptoms, came home to his mother and father to recover. Now, he just thought that was a flu, right? He had not been tested. He went home. Both his mother and his father got sick. The gentleman and his father has died from COVID. The mother is just returned home from recovering from COVID, but she's lost her husband and her son as a result. And then there's 4 other members within his family that are currently dealing with the COVID. And what he said yesterday was, the media is talking about the disparities, about how this is impacting the African American community. My family is a testament to that. We're dealing with that right now, and that's the reality. I think that along with just statistics, you're seeing the faces of people that are struggling with this, but you're also the amount of grief that everyone is carrying right now. We just had a clergy meeting earlier today, and we've been having some over the last few weeks, where clergy are kind of grappling with just the amount of grief that they're carrying. The fact that they're the only ones or a few people that could bury someone, that they can't get in contact with some of the older folks that don't have access to Zoom and computers and internet. And so there's just there's a lot of work to do, but what we're choosing to do with our time and our organizing is that there has to be a group of people that are organized and thinking about and casting a vision of what society will look like after we come out of this. Because one thing we are very clear about, that the world that we knew a few months ago does not exist anymore. And so how do we participate and build the capacity and build the power to help shape the world that is going to come?
Very well put, Khalid. Thank you so much. I absolutely appreciate your giving this, descriptions of how grief, looks for someone who's actually going through it. So you characterize beautifully all the statistics that we keep looking at, and sometimes can't quite make sense of them. But I am very tickled by the idea that you came from Mississippi to work in Louisiana, because we have someone who is in Mississippi, who joined us and is one of our guests. So I'm going to move the conversation to Rashun Miles, who will give us a little bit of what he's seeing in Mississippi, and he will introduce himself. He'll do it much better than I can. Go ahead, Rashun.
Hi, everyone. My name is Rashun Miles. I'm a graduate of the MSW program at University of Michigan. I'm now at University of Mississippi, and to be
doing a PhD program.
PhD program. I'm in the social welfare program, and quite frankly, I'm here now. I got permission to stay, but to be quite frank and quite honest, Oxford, Mississippi right now is in some ways a ghost town. It's my housemate is here, and it's everyone who was allowed to stay on campus, the residents, because I stay in graduate housing, maybe 30 people here. And so it is a ghost town. So in some ways, it's the realities of what's going on in Oxford, Mississippi. For me, I don't see it when I walk out the door, but once I turn on my computer, my phone, call my family, I look at the statistics, it's real. And when Robin was speaking about Louisiana and think about the history of infectious disease, it brought to mind the tuberculosis and the romanticizing of tuberculosis, especially in France during the worst times, and that 1.5 million people still die from that disease today, dying from tuberculosis. So actively coughing. And so if you're dying from it, that means that you're spreading it also. And while we only see less than 10,000 cases here in the US, there's something about the history of the romanticizing that is powerful, because in India and China, there's stigma around tuberculosis. There's no romanticizing about that. Like, you know, they don't look to John Keats or La Traviata in thinking about tuberculosis. They think about the grandmother who's coughing and that no one talks about that. So, so I say that in thinking about how not to, in some ways, romanticize about this COVID-19, and that there could be a moment where there could be some romanticizing about this disease, and that it could, you know, I can't think of another word, but it can be infectious, and thinking about romanticizing that. So I think it's good to have like these real conversations about these things. And while I'm not on the front line, like here at University of Mississippi, I do, you know, I volunteer at the food bank. And also my work is around museums and access to public spaces. And I'm part of a second cohort of students from Mississippi who will be working with the Jackson Heart Study data, and that is data collected in Jackson, Mississippi since 1998, so it's the longest running and most research that's captured cardiovascular disease in African American population. So, so we were just on a call last week, and COVID-19 is now on the table for discussion in conjunction with cardiovascular disease. And so my research is mainly around access to public spaces and creating like spaces of possibility and spaces of well-being. And so I'm interested in studying infectious disease, as well as looking at new ways of thinking about interventions. And so,
Rashun, let me stop you there for just a moment, just to remind us. So Rashun and I worked together here at the University of Michigan on HIV prevention. So I just want to, you know, bring the HIV angle, because that in many ways we will spark the conversation around LGBTQ plus issues. And so I want to ask you to, you know, just say, you know, finish your piece, and I'm going to be moving this to Leon Golson, who is, you know, has been working on the HIV epidemic for a long time, to give us an idea as to what it is that he sees the connection between those two epidemics, and to ask Leon to also give us a little perspective on how he's seeing his clients, who I think the majority of whom are LGBTQ plus identified. So from Rashun to Leon, but I want to give you like, you know,
I'll just do like 30 seconds. So yeah, just think about interventions. And so yeah, I had the option of going home, which, I mean, my home base is Philadelphia, New Jersey, New York. And I decided to stay here in Mississippi, not so much out of fear, but just out of, and also Michigan, I have a base there too, but there's something about going to a space that I know will no longer look like the space that I remember it 3 months ago, and having the conversation. So in some ways, I'm not prepared to do that. You know, people who, you know, as a PhD student, the stresses are already high. Everything is online. So then to have to come in contact with these new spaces that I'm just not really ready to prepare for. So I've been trying to do as much work as I can from a distance. And while not fearful, it's just protecting myself and emotionally, and not reacting emotionally. So
I'm happy that you're there and safe.
Yes.
Leon, could you talk to us?
Sure, I can talk to everyone. Hello, everyone.
Hello, Leon.
David and Rashun. So good to see you faces. So again, I'm Leon Golson, Director of Prevention Programs for Unified HIV Health and Beyond. Been conducting HIV prevention in the state of Michigan for about as long as I've been living with it, which is 30 plus years now. So I have that I can kind of reflect on. So exactly what you want me to share, Rogerio?
You can share anything you think would be of interest to this group of people who want to know how we are doing with the HIV pandemic in the state of Michigan, and particularly how your clients who identify as LGBTQ plus are dealing with the COVID-19.
Okay, well, I'll talk from my agency's perspective. And from that perspective, we're definitely putting our clients' health and safety first. So right now, we are not having clients physically come to the office because we are not prepared, but we are gearing up to prepare for that. We actually had an all-staff meeting today, and we're projecting our open office day where clients will actually physically be able to come in will be June 1st, if all goes well. So in the meantime, we're working on pulling together procedures and protocols on what a client visit will look like, if that's, regardless of if that's for case management or for HIV STI testing. The challenge is trying to secure, before June 1st, all of the safety equipment, personal safety equipment that's needed, and all of the cleaning materials that's needed. That's a big challenge, but we are trying our best to shake the trees and see what we can get so we're prepared come June 1st. Our state health department is, of course, well aware of what's going on and how it's impacted its funded entities, and they are trying to be as supportive as they can be, given that they're are also focused on, COVID-19 for the state. They've actually got set aside some virtual FaceTime with their funded partners to answer any questions, concerns, provide any technical assistance that an agency such as ours will need. With regards to the LGBT community and interacting with them, we've been using our social media platforms creatively to try and keep in touch and stay in touch with our clientele, our consumers, our clients. We are trying to do as much virtually as possible. We're giving some thought to in-home HIV testing in the near future. We'll also be wanting to move an intervention that we're currently running face-to-face, which was called Healthy Relationships. We're going to try and do that virtually as well. Some of the prides here have, of course, postponed their original dates, trying to move them either later in the year. Our major Black Pride, that's billed as Hotter Than July, is going to go virtual. So I'm still trying to wrap my head around what a virtual Pride is going to feel like and look like. And I'm old school when it comes to, a lot of this modern technology. So I don't get it, but we'll see where that goes. I know for me personally, this has brought up some mixed feelings. Some feelings I thought I had put to rest, resurfaced. One particular incident that sticks out that I'll share is when this first started to come to a head, and we were trying to figure out what we we're going to do with testing, if we were going to continue it or not. One of my team members said, well, Leon, why don't we buy those face shields, and then we can do testing, and we can, gown up and gloves and all of that. And I cringed because it reflected back to the early days of HIV infection. And I'm like, I wouldn't want to have someone coming into a testing situation, like that. So I was a little caught off guard at how that really impacted me. Since then, unfortunately, we're going to have to look at considering putting those measures in place if we want to continue some physical interaction with individuals. Mm-hmm. Our testing technology now, of course, cannot be done virtually. So we'll see where this all goes. We're trying to, as I said, be as creative as possible with our social media to stay in touch with our communities. We do have some syringe access programming going, and we're doing that, keeping in mind the 6-foot distance. We have a mobile unit that's parked out in our parking lot, and our lead person in charge of that sets up appointment times for individuals to come to the mobile unit and get whatever they need with regards to syringe access.
Leon, I'm going to stop you there for a moment. I'm going to actually ask Jeanette because she when you said the word cringe, related to having the gown and everything else, I saw the reaction on her face.
Yeah.
And Jeanette has also done a lot of work related to HIV. So Jeanette, would you like to comment on that, Jeanette, before I go to Marc and Beth to ask them to give their perspectives on LGBTQ plus issues at this moment?
Yeah, so I also am living positive since 1984. So I have that relationship to the masks and the gloves and everybody coming in and quarantining and nobody wanted to breathe your germs. I mean, honestly, though, I went into the supermarket and that's how people looked. So it might actually be easier to do, but it could take you back. The other thing that I was thinking that I connected to when you were talking is this kind of very casual, the fact that everybody can go online. Right. So you were talking about doing a workshop online. One of the things that has we become very aware of that I think we've kind of taken for granted is that there is still a huge digital divide in this country. And the assumption that, cell phones take care of everything, because almost everybody does have a cell phone. They don't have unlimited data plans. People are kind of like, when we're saying, oh, we could do your counseling session over the phone, and people are like, yeah, that's an hour of my, because a lot of our low income clients just have basically minimum service and minimum data. And so although during COVID, most of the providers have kind of extended that for the Lifeline clients and stuff like that. I mean, I just, when we said to kids, oh, you can do online learning, not really. There's a big difference between a cell phone and a computer. And so we have just become increasingly, I'm in New York City, very aware of the digital divide as we so casually said, oh, we can do everything online, and everybody can't. And then the other thing I would just say, as somebody who serves a lot of LGBT homeless young adults, is that, they are very much group animals. Their whole support system and way of life is very kind of social and interconnected. And some of them are really, really struggling, even though they have their own units. Isolation is overwhelming them. And we have restricted, to no more than 2 guests. And that's just a very, very different way of life. And I really do think that they're leaving the building and putting themselves at risk just to be in more social situations.
Thank you, Jeanette, for making that point. I'm going to go quick to Jen very quickly. She says she has a point to make related to what Jeanette said, and then go back to Leon if he has anything else to say, and then to Beth and Marc.
Yeah, I just wanted to thank you for bringing up the digital divide and technology just generally. I mean, I think this really connects back also to what Lady was sharing with us earlier, is there's just so many communities, particularly in Louisiana and in the broader Gulf South, where it's not only like lack of access to computers or phones but also to broadband in general, where people are able to actually get online at all. And so sometimes, even though there's been the public libraries in Louisiana have left their Wi-Fi's on and you can go to the public library, but for some people that's, like a half hour to an hour drive. And so I think that piece, when we're thinking about working online, as well as telehealth and telemedicine and a lot of the things that really intersect with a lot of what a lot of this community does, it's really important for us to pay real attention to an equity focus and an access focus with what that means. And I also am just kind of thinking about the way we deal with disaster and other things that affect connectivity as well. I know those of you in Baton Rouge, we had some really impressive storms yesterday, and it's a reminder that we're also about a month out of hurricane season for those of us in the Gulf South. And one of the things that I found interesting is the way that the people cope with this. I cope with this, we all cope with this in ways that are very similar and very different from dealing with hurricanes and dealing with natural disasters, and that there's a certain sense of a disaster having happened, but none of the visible markers that we normally see, and people overbuying white bread in the grocery stores, but that not really kind of being what's needed in this moment. And so I think just this access to technology and broadband and internet is really something that we really need to think about in our broader conversations moving forward, and then and continue to think about as these as we move forward, kind of going through this, and just kind of be curious about too how, if there are storms this season in the Gulf South, like how those then further isolate communities, if this is the way that we're connecting to healthcare and to each other.
Excellent points, Jen. I'm getting worried because we only have like 6 minutes. We can go like a couple of minutes beyond, of course. And I really want to, I want to make sure that everybody reads what David had to say in the chat, because it's a very clear example as to how these things actually affect, COVID-19 affects specific populations in very different ways, and how this whole idea of having to go back home, to stay inside of the same home, but if it is a home that is not welcoming you, that could be like very, very traumatic. And that's what's going on for many LGBTQ plus young people, and not only, the young ones. Leon, can I go right to Marc? I mean, did I give you enough time to say all that you needed to say?
You did. I just added one note that, I did hear, and I do understand that not everyone has access to, the virtual world. So one thing that I'm going to be asking our state health department, since they're being very creative financially, is if they can support us, or their funded partners, to provide that needed technology for individuals who may not have it, or it's limited in some way. So I'm going to ask if they are willing and able to support our outreach efforts virtually, so that we have a less of a gap between those the haves and the have-nots when it comes to that.
It's going to be interesting to see how the state and the federal government will have to fund infrastructure for provision of services. Beth, you told me the other day.
Yeah, I was just about to tell that story, right? But
yes.
Sorry.
No, I want you to tell this story.
Oh, great. Yeah, I'm Beth Shermman, and I teach at the University of Michigan School of Social Work. And when Rogerio asked me to speak on LGBTQ plus issues today, I just told him that I just talked to a mother of, I have a 19-year-old daughter, and some of the students are home from college. And so I was talking to a friend whose young daughter is home and is just coming out as a lesbian, and involved in her, dating this a young woman at school. And, she's in a very safe, and when they had to come home, my friend's daughter is in a safe and supportive household, but her girlfriend is just going, where she was just coming out, is just going home to a very adverse situation in terms of the family being very anti-gay, and just the amount of surveillance that she's experiencing, and her fear that she's going to get thrown out of the house. And there's really, it's often a fear with young people. I mean, there's such a high rate of kids getting kicked out from their homes related to gender and sexual orientation. But so she's just so afraid she's going to get thrown out of her house, or her parents won't pay for her education, which again, of course, that's a privileged situation, but just that real and present fear that for some young people, again, being out of the house, is a lifeline, and that many kids sort of survive their families and then try to find communities when they get older, and just, with people having to return home or not having other places to go, a lot of times they're returning to adverse situation and that isolation and surveillance. So I did, I know we're in terms of time, I wanted to mention that the Cancer Network. I think I'm getting the name wrong. I just asked if Nikki, if he could pull up and share the link that on April 1st, 2020, the Cancer Network, I believe it's Cancer Network for LGBTQ populations, wrote a really comprehensive report on COVID, and they made several recommendations that every organization think really specifically, as always, about LGBTQ populations in terms of their messaging, because for all the reasons we've talked about, with the social determinants of health and lack of access, that's of course just being exacerbated in this pandemic. So just, can people still hear me? Okay, can people hear me?
It's chopping a little bit, but we can still hear.
Sorry, okay, just that there are very specific recommendations about messaging, particular to LGBTQ populations, because they're just, you know, a lot of LGBTQ people have very difficult relationships with healthcare providers, in terms of discrimination, not being recognized, not having their pronouns or their identities respected. So just very particular in terms of equality and inclusion. The other thing is, you know, as David mentioned, this is just a time where there's so much underhanded things going on because we can't pay attention to everything. And so the move to roll back the Obama's administration's equity of access related to gender identity and sexual orientation is there. I think that there's a report being released that's going to roll back that protection, and you know, so it's under the, you know, while we're paying attention to other things, that kind of stuff, those kinds of moves are being shot. Okay, so so just in any way, and just particular organizations and activists doing very particular messaging around GLBTQ people, just even like for volunteering or faith-based organizations that are, of course, doing a lot of the work, if there would be LGBTQ inclusive messaging going out so that people can feel free to volunteer and also ask for service, so they don't worry that when their domestic situations are being discovered that they're going to be experience violence or exclusion. So I think those are my main, and last but not least, school can be a huge protective factor for LGBTQ kids. So for a lot of kids who aren't able to gather in the safe spaces of school, I mean, but it's often a mixed bag, because we know for a lot of kids, school is not a safe place at all, you know, related to LGBTQ race and all kinds of other intersectional identities. So to the extent that schools are becoming safe spaces, it's very important. And just the other piece of it is that some LGBTQ kids are really relieved to not have to go to school because they're bullied and experiencing a lot of violence there. So I think it's a both and situation.
Pay attention, everyone. It's interesting the way Beth, you know, kept moving from one thing to the other, right? I mean, it's like almost like a link from, you know, it was incredible the way she you know, she would say something and then, oh, there's this other link, and then there's this other link. And I think that we can find those links, you know, for every population that we know has historically been underserved, undermined, sometimes forgotten, sometimes disposed of. You know, I'm using the words that, you know, the guests, you know, use, you know, like Robin talked about disposable and stuff like that. I'm making a decision not to.
Can I just say one thing? Quick thing?
Yes, very quick.
Just thinking about sexual partner notification in COVID and LGBTQ communities, and thinking about like how it hasn't been talked about, but in the media, but thinking about like someone who isn't out, who may have had sexual experience, and having to, and not particularly know who that person is, or know who that person is, but not willing to disclose that information. I think that is important too, and thinking about the spread of COVID and who are like, and having sexual partners and not disclosing if one comes up positive with COVID-19.
Contact tracing, right?
Yes.
So we could go on with the conversation, but I'm trying to really keep this to an hour every week. Please absolutely read what Angie Perron said in the chat about Detroit, which I think is really very important. What Chelsea, you know, was asking a question that we are not going to be able to answer today. And then there's a lot of information that lady just, see, I was able to do it now, lady, you know, without saying the last name. Good information there, and more from Ange Biron.
I'm proud of you.
It didn't take very much.
Did we hear from Marc? Hey, Rogerio, did
No,
we
we
hear
are
from
not.
Marc?
So I made a decision that Marc's coming back because I don't want him to just, you know, he has a lot to say. Marc's a very intelligent man who has a lot to share with us about all the issues that we talked about. So I am going to be saving him for the next time. Of course, every time that I do this, you know, the guests who came for the day will, you know, will be invited to come back if they would like to. So you will be getting, you know, invitations to come back to the discussions, and we can go back to talking about the many things like Jeanette just did today. You know, she came 3 weeks ago, you know, for the New York conversation. Here she is for the Louisiana conversation. So, but I would like to thank everyone, Leon, Khalid, and Jen, and Robin, and Lady, and Rashun for being my special guests today, and can come back anytime you'd like. I will be in touch with all of you. Thank you so much for joining us. This has been wonderful again. Marc will come in the near future. And I can't announce exactly what it is we are going to do next week, but it looks like it may be a crowd from Newark, New Jersey, which I'm trying to organize. And we'll probably have a special guest from Brazil to talk to us, a virologist, to talk about the virus itself and the biology of the virus, which I think will complement in many ways the things that Robin shared with us about the history of epidemics. So without further ado, thank you everyone. And I just want to very quickly acknowledge Eddie again, who you see, you know, yes, waving at us, who's my co-chair for the Faculty Alliance for Diversity. When I was introducing her, I think she went, you know, she was doing something with her kid. So here we are. Thank you guys very much, and stay well, stay safe, and yes, just take care of yourself.
Hey,
Bye.
Bye.
bye-bye.
Thank you. Thanks, Rogerio.
You're very
Wonderful
welcome for having
session.
us.
Wonderful
if you want
session.
me to kill you, come
Thank
down
you.
here, idiot.
Y'all have a
Thanks.
good afternoon. Thank you.
Thank you so much, Khalid.
Bro, you suck, Diva.